Medical professionals of Reddit, what diagnosis gave you the worst pit in your stomach feeling? Obviously very advanced, previously undiagnosed cancer presenting to ED for anything. Feeling multiple golf ball and baseball-sized lumps or an abdomen full of tumor is sobering. Healthy kid has some new minor neurological symptom, tremor, headache, poor balance, and MRI shows big, huge, bad brain tumor. ED nurse here. I remember one time, a patient was diagnosed with a dissecting abdominal aortic aneurysm. The MD told the patient he'd be rushed into surgery soon and to immediately settle any affairs and talk to his loved ones, as the likelihood of him not making it off the table was high. It was just surreal seeing this guy talking to his wife and kids knowing it may be his last. Late teens patient diagnosed with inflammatory bowel disease, but CT showed metastatic colon cancer. My dad is a radiologist. Back when he was doing his residency rotations, he had an elderly woman come in, full of joy, talking about how happy she was that she was officially 1 year cancer-free. He had to tell her that her scans were absolutely riddled with cancer everywhere. He cried telling her, and she comforted him. Bacterial meningitis. In the lab, we are the first to see it. It's very scary to think about how close someone could be to dying while you look at their spinal fluid on a slide. Specific to my field, occupational therapy, when patients get spinal cord injuries and plateau after improvements, it all looks like they recover mobility, but they won't, but they still think they will. Or when you get a post-stroke, and recovery is minimal, but they think they recover fine. Fellow hypochondriacs, anxious humans. This comment is your reminder that this thread is not for you. Also, I'm one of you. I am only here to give this reminder. Non-accidental trauma, NAT, in kids. I was taught during residency that if you have never diagnosed NAT, you aren't looking hard enough. I think about those words a lot, and now I teach them to trainees. In my field, brief psychotic disorder or schizophreniform disorder. It does always happen, but often they convert to schizophrenia. Arriving on the scene of an accident, and you can tell what kind of vehicle you were looking at. Glioblastoma is a pretty bad one. Anytime I wake up a patient way earlier than they or their family were expecting. That means the cancer, usually something in the belly, was worse and had progressed more than anyone knew, and surgeons couldn't even attempt to remove it. Paramedic here. 0500 in the morning, we were called to a house. Mother was worried about her preteen daughter acting depressed and weird. Normal house, siblings having breakfast. I was dead tired. After 10 mins of waffling words from Mum, where I semi-zoned out, she said something my partner picked up on. She had described a seizure. We recommended she see her GP. That night I got called in for a transfer. Daughter had advanced metastatic brain tumor, off to a major hospital for treatment, which essentially meant make her comfy while she dies. My neighbor was babysitting my then 11-month-old for the day. Her dad was my last patient of the day, coming in for sternal pain. Initially suspected costochondritis, as he told me he does 500 crunches and 100 push-ups a day. Very well-known legend in our town, the fittest of fit, non-smoker. Chest X-ray showed advanced, incredibly rare type of lung cancer. No known successful treatment. She walked in to drop my son off right as I was pulling up the X-rays. My heart has never sunk that low. He died within 3 months. No heartbeat on an emergency fetal ultrasound. When I did find a fetal heartbeat on a patient at her 39-week prenatal apt, it's happened twice in the last year. Full-term fetal demise. As a medical laboratory scientist, seeing blasts, immature cells, in a pediatric spinal fluid. This generally means that treatment is going to have to be altered, more intense for those kids that have already gone through leukemia treatments. Neurologist here. Seeing patchy muscle wasting, fasciculations in the tongue, asymmetric weakness onset over a couple of months, and brisk reflexes in a young healthy, usually very friendly and lovely person. Else. A really good friend of mine was diagnosed with lung cancer. She died in 6 months. She told me she felt so bad for the doctor who had to tell her. Rest in paradise, my sweet friend. Fairly young patient came in with no symptoms after having low hemoglobin caught incidentally on routine blood work. Baseball-sized tumor in the stomach. These cases always haunt you. GSW, especially with children. Gas stations in Detroit are not at all safe. Moved a sore spot on the side of my tongue for 2 months, and it just isn't going away. It was squamous cell carcinoma. The patient was dead about 12 months later. The initial treatment actually went quite well apparently, but it metastasized. Patient with the same exact birthday as me has a 1-year-old in the waiting room, pregnant with her second, and I'm doing biopsies of her cancer, which was at least stage 3, so humbling and scary. Anytime someone tells me they are just glad their cancer didn't come back and the scan says, the cancer is back and it is everywhere, I can still feel the sinking feeling I had when I read the results. Anoxic brain injury in a teenager who took a few of their mom's Percocets. Harlequin disorder in a NICU baby, and explaining to the parents that it does not go away. Don't Google it unless you're okay with grotesque. Listening to the attending explain that there is no chance it will go away as mom stared off into space because I'm sure it was all too much to take in. Shortly after an unplanned section, the way her eyes lost every bit of light was startling. Or scrub nurse stat necrotizing fasciitis cases, flesh-eating disease, advancing faster than we can pump high-dose antibiotics into them. We basically rush them in and cut away everything infected we can as fast as we can, while racing the clock on the patient being too sick to be under anesthesia safely anymore. Pack with iodine and race to the ICU. I've seen a doctor follow the stretcher still wrapping the packing while they took off out of the OR. Not only does my stomach drop for the patient, but it's just the most awful case in every way imaginable. From equipment to smell to clean up all the way to the other end of the spectrum of watching what is actually happening to another human in front of you. No matter what reason you got into medicine, it was for that feeling. Had a late-age teen IV drug user come into my ED with a complaint of an infected forearm. She pulled up her sleeve to show me, and I could see every structure under her skin that should not be visible. From her wrist to elbow was exposed fatty tissue and muscle right down to her bone. There was no possibility of this being treated without amputation. She refused admission and surgical consult, and ended up signing out against medical advice. I would like to think she eventually reconsidered and returned to another hospital for treatment, but no good outcome could ever come from her condition. She either became septic and died, or did seek further treatment and had the lower arm amputated. It's incredibly sad that this was the life of a beautiful woman who was not even 20. Painless jaundice in anyone over 60 is an instant sinking feeling. Patient discharged from the ER a couple days ago due to high blood pressure, readmitted for Bell's palsy. CT of the brain was negative for stroke. I did his swallow eval. Oral stage was unremarkable, but he could not swallow anything no matter the texture or amount. Would start coughing, choking, etc. Bell's palsy can affect the oral stage of swallow, but never the pharyngeal stage. I told his nurse, I know his CT was negative, but can we ask the attending for a stat MRI of the head? This definitely isn't Bell's palsy. They agreed. MRIs will show fresh strokes, whereas it may take a few days to show up on a CT. I was right. MRI showed he had a brainstem stroke. Too fresh for the CT to pick up on. I got a certificate and a big plate of cookies for my good catch. Placenta percreta. Nightmare fuel. Anytime I see pathological fractures, meaning fractures not caused by a fall or trauma but fractures that just happen, especially if it's in a femur, 9 times and it's cancer that has metastasized to bone. The outlook is not great, and the pain is awful.